Hello, and thank you for contacting Wave Support. I see from your request you're struggling with a couple issues with your patient. The first question is having to do with the peripheral curves. If I understand that your right lens tends to be rather tight and your left lens is kind of loose, and you're debating what changes to make with that design versus maybe going to a little bit different design. I also understand the second part of your question has to do with the bifocal power and position. Just a kind of a general comment, if you're working with a semi-scleral lens, as you know, these lenses don't move a whole lot, and it seems like a lot of the wave docs have found that they do a little bit better with a near center lens on these super large lenses just because they don't move. And so what I'd probably do is see if you can nail down the fit first, and then after that you might have to do a little trial and error with the bifocal design. Well, let's first talk about the design. The right lens, I'm looking at your design here. It's actually a pretty nice looking lens. If I understand right, this right lens is sealing off and not a whole lot of movement after several hours, so it sounds like you really need to get some more tear clearance in there. And overall, this looks pretty good. If you're pretty happy with the overall design and you're just trying to get it looser, the quickest way to do that is just get this peripheral curve up a little bit. What I'd probably do is get this, if you notice you're pretty well pinned at the 20 mark, I'd probably take it over here and bring this up a little bit higher, get that up a little flatter in that meridian, and then I switch back over to 100 here and bring the whole thing up about 5 clicks or so. And that should go quite a long way into lifting up that peripheral curve. If you look at the left eye, I'll bring this one over. The lens actually looks pretty good over here. However, what I'd probably do, I'd encourage you to really try to follow that 8-point step that Wave has on their Wave design fitting to see if you can get a little bit better alignment out here in the peripheral area. The easiest thing to do if the lens is fitting reasonably well to get it to be a little bit snug or just go larger, that's a quick fix. Or what I did, actually, I did kind of a mock-up of a lens here using the Wave 8-point step. And I'll include that link for you in case you haven't been able to find it on the email. And I went through and just actually went a little bit larger, followed that 8-point step. And even though intuitively it seems like this would be a little bit tighter here versus this design, if you really look at this back surface of the lens, the radius of curvature, when you come in through here, you're about 775 centrally, and in this design here, we'll go over here, we're still a 780, a little flatter, but when you come out here to the peripheral curve, you'll notice on your design, yours hovering right around 21, 20, 21, 19, maybe a little over 18, so in that range in the radius of curvature. And if you click over here in this design, you'll notice that we've dropped down a little bit there, 16s, 17s, and so you get a little bit more steepening effect out there. So I wouldn't be afraid to try going a little bit larger on that lens. Now the other thought was, should you consider going to a totally different design? And if we go back to this right eye, maybe going back to a corneal design. As much as I like the semi-scleral designs, sometimes they just do real well with a large diameter on cornea lens, go up about 11.5, right about almost the full diameter of the lens, and just try to get this lens to nicely lay down right through there. And as you probably know, if you've worked with a few of these patients, the question is, do you land this lens outside this steep zone or inside, or how do you do that? You could probably go either way. I try to initially at least match it as closely as I can. And you'll see this lens here, if you look at the back surface design, it very closely matches this cornea. And there's a couple little steeper areas here. If you want to iron those out a little bit, you can do a little bit of an aspheric design. And that tends to soften up some of those curved areas a little bit more. And if you look, this back surface almost perfectly matches here. And that should give you a very nicely aligned lens on this post-operative cornea. Another thing to consider, axial designs, as you know, tend to look at the central cornea very closely and maybe not quite as closely at this peripheral area. And so if you have any alignment issues here in this peripheral cornea, don't be afraid to switch over to tangential design. That may give you a little bit nicer alignment out here. Tangential is slightly flatter in general, and axial are slightly steeper. With that said, I hope these tips are helpful to you. I would look back again at these, maybe making a couple simple changes in that peripheral area on both lenses. If you're pretty close, those semi-scleral lenses can work very well. If you do stay with a semi-scleral lens, you may end up going to a center near design for the bifocal. Anyways, I wish you well and thank you for contacting Wave Support. Have a great day.